I'm Dr. Sloan, physiatrist here at Steamboat Orthopedics, and basically I take care of back pain. And so one of the more common complaints that I get is back pain in the low back or in the neck that doesn't travel anywhere, okay? And typically that type of pain comes from joints in the back. The fancy term for that is lumbar spondylosis, but just think of it as arthritis in your back or neck. So this can happen to anybody. In fact, most of the time I can find arthritis in anybody in their 20s or 30s or older than that. So it's a very common problem that we run into. But common complaints that I hear from patients when they have arthritis in the back is if they stand in one position or they're slightly bent over, like someone working at a workbench or standing at your sink doing dishes, they get pain across the low back. That's very aggravating. Sometimes they're not even able to finish the dishes. They have to go sit down. They sit down, they start to feel a little bit better, and then they go back and finish the dishes. In fact, it's so common that I've started calling it the dishwasher sign. So if you have some pain like that, it's likely due to some arthritis in the back. And when we talk about the joints in the back, okay, you have joints on each side at every single level where your vertebrae come together. And just like almost any other joint in your body, that joint can get worn out, arthritic, and can get achy and sore. Okay? So one of the common ways that we take care of arthritis in the back is we do a series of procedures. The first few are called medial branch blocks, and the last few are called radiofrequency ablations. But in the back, every bone has a little wing on it, and there's a little notch or saddle in that little wing of bone because there's a very thin nerve that runs there, that runs to the joint at the same level and down to the joint down below. And it tells your brain if that joint is achy from arthritis. So what we do with the first few procedures is usually specialized x-ray equipment. We guide the needle down to those little notches in the bone that I see on the x-ray, and we block that nerve with a long-acting numbing medicine. Now, these first two procedures called medial branch blocks are nothing more than tests. They don't treat anything, but they test to see if this is actually the cause of your pain. We numb the nerves, and if for about 5 to 8 hours you go, wow, I felt great, I wish I could always feel like that, then you pass the test. If you pass that test twice, then we go on to radiofrequency ablations, where I take specialized needles down to those same notches and nerves, and we put a little insert into that hooks up to a machine that sends a pulse through the needle that gets rid of those nerves, so that there is no longer a nerve telling your brain that your joints hurt because of arthritis. Now, one common question that I hear from this is a lot of patients say, boy, shouldn't I feel if I do something in my back? And the answer is yes, you should. You want to feel if something happens in your back. But those aren't the nerves that we take care of with this. So if you pull a muscle in the back, if you break a bone, if you herniate a disc, if you pinch a nerve, you will be able to feel all of those things. We are just getting rid of the nerves that tell your brain that you hurt from arthritis. That's it. And it's a fairly straightforward procedure. Very minimal pain. We use numbing shots. You don't even have to go to sleep for this procedure. So if you're having some back pain and you want to learn more about this, go ahead and schedule an appointment with me or a member of my team here at Steamboat Orthopedics, and we'd be happy to check you out and get you taken care of.